Hello and welcome to Kinetic Health. My name is Dr. Brian Abelson. Today we're going to discuss Achilles tendonitis, a very common injury seen in runners. In fact, 11% of all runners will experience this at some time in their running career. The Achilles tendon is made up of two muscles, the gastrocs and the soleus, your calf muscles, which form what we call a cold joint tendon, which inserts right here at the base of the heel, or calcaneus. Often what occurs in running is a form of a repetitive strain injury. The individual will start to develop small tears or micro tears in the tissue, and these tears will cause an inflammatory response, and the person will start to lay down what we refer to as cross-fibrous adhesions or scar tissue. The problem is that we'll get different layers of tissue actually adhering together. This causes more inflammation, more scar tissue formation, more friction. Eventually this gets worse and worse until we start to get larger tears within the tissue itself. One of the first things we're going to do when someone comes in with complaint with pain at the Achilles tendon is we're going to go through their history. We're going to ask them, have you increased your mileage lately? Have you been doing more hill running? What's your training routine been like? Have you been working on your flexibility exercises? Have you been doing weight training in conjunction with your running? It's very common for injuries to occur in the Achilles tendon when we have an area that is quite weak or inflexible. When we're dealing with a case of Achilles tendonitis, it is extremely important that we do a biomechanical assessment of the individual. Different individuals will come in with exactly the same symptoms, but different structures in the body will be affected. It could be just the calf muscle itself, or it could be structures on the opposite side. We could also have areas such as the tibialis anterior in the front that are quite restricted, which are also affecting the posterior of the leg and eventually the Achilles tendon. It could even move up into the hamstring and the glutes. Very, very common. It is extremely important that we use the right treatment techniques once we find the restricted area. If we just get in on the Achilles tendon and start doing cross-friction massage, this can actually make the condition much, much worse. Also, there's a considerable amount of research that has shown that steroidal injections should not be injected in this area. This will cause a weakening of the tissue and easily injure the area to the point where you'll get further tears even within a short period of time. One of the most successful means of treating this condition that we have found at Kinetic Health is to use a technique called active release techniques. Active release techniques is designed specifically for the breakup of scar tissue. In this case, we may get directly on the gastroc soleus, but we may need to work our way in around the Achilles tendon, actually getting underneath a sheath underneath where the tissue translates. Now, we talked about biomechanical analysis. What structures we actually treat are going to vary greatly between individuals. For some individuals, we may only get directly on the Achilles tendon and the gastrocs and soleus. For other individuals, we'll need to work on the anterior, on the calves, underneath the foot, even up in the hamstrings and the gluteal muscles, depending on which structures have been affected. Effective treatment of the Achilles tendon or any soft tissue injury requires an alteration in tissue structure to break up the restrictive cross-fiber adhesions and restore normal function to the affected soft tissues. When a treatment is executed properly, you'll substantially decrease the healing time, treat the root cause of the injury, and be back on the road in no time. There are several techniques that we have actually found to be effective. As we mentioned, active release technique, Groston, and in many cases massage therapy works extremely well for this condition. Again, the key to successful treatment, the treatment must be very specific and based upon the individual's needs of each athlete or runner, rather than some preconceived idea about what needs to be treated.